I can see I can see you're very worried, but don't be worried, Jimmy. We will give you whatever you need. But in the meantime, I need to ask you a few things, so I'll be in a better position. So, what do you think about that?
Yeah, sure.
Okay. So, Jimmy, apart from this anxiety, do you have any other medical condition?
No,
Okay. Are you taking any medication apart from anti-anxiety drugs?
no, I'm not taking any medication right now.
Okay. And are you taking any? Are you allergic to any medication or anything else?
No,
Mm-hmm. And anything running similar symptoms in the family?
similar symptoms like what?
Any medical condition?
No, doctor.
Mm-hmm. That's great. And any cancer condition running in the family?
No,
Okay, that's really reassuring. And few things from your lifestyle, like any smoking or alcohol. I need to know anything important.
yeah, I have been smoking for like I would say for past 20, 30 years.
Okay, and how much it is?
4, 5 cigarettes per day.
Mm-hmm. And okay, Jimmy. Now, tell me about your, you are having this anxiety. So, how are you coping with?
Yeah, I'm fine now, doctor. I used to have
Mhm.
that 5 years back, but now I am doing fine.
Okay. By any chance, any problem with your mood nowadays?
No, I feel my mood is better.
Okay, I'm really happy that it's working for you. So, anything apart from this, any sleep problem?
No,
Okay, and Jimmy, sometimes with similar condition, people think they can hear something, hear they can hear something, they can see lots of things. Do you think you have this sort of problem?
no.
Okay, that's really great. So Jimmy, you told me that you are having a concern for you have a concern for cancer. By any chance, have you feel that you are there you recently there are changes in your weight?
No,
Any lumps and bumps anywhere in the body?
no,
Okay. And any changes in your appetite recently?
no.
Okay. So Jimmy, I would like to examine you by checking your vitals, doing general physical examination, and also have a look. So how does that sounds with you?
Yeah, okay, that's fine.
Okay. Okay, Jimmy. After talking with you, I can see you are very concerned for cancer. But I have a good news for you that you doesn't have any symptoms for cancer, and it is neither positive in your history.
Okay. But don't you think, doctor, at this age, I am prone to get the cancer?
Uh, okay, people sometimes have got cancer, but there's some certain symptoms or it's running on their families. So in your case, they're totally negative. So at the moment, we can say you really don't need to be worried. So how does that sounds with you?
Well, doctor, my friend, he was working with me. He was my work colleague, and he recently
Mm-hmm.
got diagnosed with cancer. So I was really concerned because we have been working together for past 20 years.
Okay, I can see. I'm really sorry for your friend, but I need to ask few things. Like as you told me that you were working in the same place. May I know what you do for a living?
Yeah, I am a school teacher.
Okay, and how long you were doing?
Yeah, I am doing fine, I think.
Okay, so apart from this, do you have any more concern?
No?
Okay, okay, Jimmy. Let me tell you that you have talked each other. You have worked with a long time, and maybe your friend has some similar condition. You have some. He has some symptoms around the cancer. Maybe some positive family history, but in your case, it's totally negative. So for that reason, we can give you some primary investigations like taking your blood, doing inflammatory markers, checking how well your kidneys and liver can be working. So how does that sound with you?
Okay, yeah. So you're not writing cancer test for me.
Actually, cancer tests are given. We can give you some primary investigations, and if they becomes positive, we can refer you to the cancer specialist, and they can do the further treatment and investigations. So is that okay with you?
Well, okay.
Okay. In the meantime, I can ask my senior to have a look, and he can also chat with you. So am I clear so far?
Yeah, no, I'm hearing, doctor.
In the meantime, may I know a few things from your friends about your friend's cancer?
Okay.
So let me ask you that which cancer he has been diagnosed with?
Prostate cancer, doctor.
Okay, and he has some family problems also, like any prostate cancer running in the family.
I don't think so.
Okay, might be he have the symptoms actually he's passing through. That's why he has the cancer. Don't you think so?
I don't know, doctor. When I got to know about him, I got really scared because he's my friend, and I thought maybe I am at the risk as well.
Actually, I must appreciate you for your concern. I can see you are very healthy, and you are leading a healthy life. You are quite for regular follow up, taking our advices. That's why you are doing good with your anxiety. But don't be worried, as you don't have these similar symptoms. Let me ask you a few things. Like, do you have any problem with your urination by passing pee?
Time's up. Okay, time's up, doctor. Amina, well
Oh,
done. We will talk about this later. And who was the next doctor? Dr. Farah. Yeah.
Yes,
Uh, we will be doing the same station with you. Okay, Dr. Amna, and then we will be talking about the feedback. Let's see what is the difference between both of your approach, and then we will talk about the approach later on. All right?
okay, all right.
Okay. So yeah, same station for you, Dr. Farah.
Right, okay. All right, I think we can start.
All right.
Okay. Hello, I'm Dr. Ahmad. I'm one of the junior doctors here in the GP surgery. May I start by asking your name and age, please?
Yeah, I'm 75, doctor.
And your name?
I'm Jimmy Kent.
Is it okay if I call you Jimmy?
Yeah, sure.
Well, nice to meet you, Jimmy.
Thank you, doctor.
So how can I help you today?
Well, actually, doctor, I am really worried because a friend of mine recently got diagnosed with the cancer. So I want a cancer test.
Okay, I'm sorry to hear about your friend. How is he doing now?
Yeah, I think he's better.
Mm-hmm, mm-hmm. May I know what cancer it is that your friend was diagnosed with?
Well, the prostate cancer, doctor.
I see, I see. And you are worried about the same thing for yourself?
Yeah.
Is that right? Yes,
Mhm.
okay. So, Jimmy, before I get into that, I'd just like to ask you a few questions about yourself, just so I can get a better idea of your situation. Would that be all right?
Yeah, okay.
Okay. So I can see here from my notes that you were diagnosed with anxiety. Is that right?
Yeah, I was diagnosed with it 5 years back.
Uh-huh. And can you just quickly just tell me what it was that you were suffering with? What symptoms were you having?
Yeah, like actually, my wife passed away 5 years back, and after that, I was feeling terrible. And
Yeah.
I was not like, I was tearful, I was sad all the time. When I went to my doctor, they started me on medication, and but now I am doing fine.
Okay. All right. And so have you been following their treatments correctly?
Yeah,
Yeah. Okay. And you're saying you're feeling much better now?
yeah.
Yeah. So have you ever felt so low? I mean, how is your mood now?
My mood is okay now.
Your mood is okay? All right. If you were to score your mood between 1 to 10, 1 being very low and 10 being nice and high, how would you rate your mood?
6 or maybe 7.
That's good to know, Jimmy. You do sound like you're absolutely fine. So Jimmy, just a few questions about your concern here. You are worried about prostate cancer. Is there anything else that you are worried about?
No, doctor, I'm worried about it because he was my friend and we were working together. I was
Right.
having a special bond with him. And when I saw him diagnosed with the cancer, I got shattered.
Yeah, I understand you must be in a very difficult situation. Okay, so what we can do here for you is, I understand your concern. What I could do is I could just ask you a couple of questions about whether or not you have the symptoms for this. Would that be all right?
Okay.
Yeah. So, have you ever noticed any problem with your urination?
Well, I think it's fine.
Mm-hmm. Okay. Have you ever found any trouble starting your urination?
No,
Okay. Have you noticed that your stream has maybe gotten weaker?
no,
Okay. Have you ever noticed any sort of blood in your urine?
no,
Okay. Have you ever noticed any sort of a dribbling towards the end of your urination?
no,
Okay. And have you had any sort of back pain?
no,
Okay. And any fever?
no,
Any changes in your weight?
no,
Any lumps or bumps anywhere throughout your body?
no,
Okay. And have you noticed any sort of changes in your appetite?
no.
Okay, Jimmy, that sounds great. A few more questions about your general health. Have you ever been diagnosed with any medical conditions?
No, I was just having that anxiety. Apart from that, I have been fit and fine throughout my life.
Okay, I'm glad for that, Jimmy. Besides the medication that you were put on, were you taking anything else regularly?
No,
Okay, and do you have any allergies?
no,
Now, in your family, is there any medical conditions that that run in your family?
no.
Okay, and just a few questions about your lifestyle. Do you smoke?
Yeah, I'm smoking.
Yeah, can you tell me a little bit about that? How much do you smoke?
Well, I'm smoking half a pack mostly per day
Uh-huh. Okay. And for how long have you been smoking?
since my teenage.
I see. Okay. And do you drink alcohol as well?
Yeah, social drinker.
Social drinker. Okay. All right. So Jimmy, what I could do here is I could just have a quick assessment on you. I'll take your observations, which is your heart rate, your blood pressure, your oxygen level in the blood, your blood pressure, as well as your breathing rate. And I would also like to do an examination of your back passage. All right. I understand this is an intimate examination, and so therefore I will provide you with a chaperone to ensure your privacy. Would that be all
Okay.
right?
Yeah, doctor, your nurse colleague has done some examinations. These are the
Mhm.
findings.
Okay. All right. Okay. Jimmy, based on what you told me and based on the examination that I've done, I understand that you were worried about prostate cancer. Now, it seems to me that you don't have any of the symptoms, but your prostate is enlarged.
Mm-hmm.
So, do you understand what this means?
No.
Okay, so it basically, at this point, it seems to me that you have a condition called benign prostate hyperplasia.
Okay.
So what this is when the prostate it enlarges a little bit due to, it could usually be due to your age, all
Mm-hmm.
right?
Mm-hmm.
And usually, as long as it doesn't have any symptoms, it's not something to worry about.
Okay.
Mhm.
Okay. Then it means that I'm not having any risk of cancer.
So the thing is that you don't have any of the symptoms. That is definitely a fact. But because you were worried and because there is an enlargement here, if you really, I mean, I would suggest that you do get a blood test done that could specifically, or that has a blood test that can check for the presence of a certain antigen that would be present if there was a prostate cancer. What do you think about that?
Okay, doctor.
Okay.
So can you do this test for me right now?
So I can't do the test for you right now because I have done a prostate examination on you. I wouldn't get the right reading. So what we could do is that you could come back in after a few weeks' time. Oh.
To the next station. Okay. Okay. Time's up. And that's a good approach, I would say. So if I'm talking to both of you, then I would like you to, Dr. Amina, are you there?
Yes, doctor. Yes, doctor.
Okay. So what you have to say about Dr. Farah's performance?
Yeah, it was really good and is structured.
Okay. And anything that she has missed?
Actually, I think, yeah, that's the fine because he has no the prostate cancer, and then she got the symptoms, and then doing the investigations.
Mm-hmm.
So I think it's quite good.
Okay.
By any chance, she can give the safety net, but I think it's the time.
Yeah. Yeah. Okay. So anyone else who is going to add something, like if she has missed anything, any specific question in data gathering or anything in the management that you would like to add? Hello, someone was talking, but we can't hear you.
Yes, the doctor, in the management, because we found there is enlarged and bilateral, and he is asymptomatic. I think we can offer for him this medication to reduce the size of the prostate.
Okay, but do you think we will give him the medication even if he is not having any symptoms?
No, I think better not. No, better not.
Yeah, because
but it's worsening, and it worsening after a while, may inducing retention.
Yeah.
So at least safety netting him.
Yeah, safety netting him. Good. Good.
Safety net if you can't pass urine at all.
Sometimes
Yeah.
BPH also causes high PSA, so it might be misinterpreted also.
Yeah. Yeah. Okay.
I
So
think,
yeah.
yeah, hello.
Yeah.
I think there's a lifestyle modification should be done because he was a smoker since teenage, and I think there are some relationship with the
Cancer.
prostate cancer, or with the smoking.
Yeah.
So at the end, something to say about the smoking.
Yeah. Yeah. Perfect. Okay. So let's talk about the feedback now, Dr. Ahmed. All right. So your data gathering part was very good. Dr. Farah, are you there?
Yes, I'm here.
Okay. So your data gathering part was very good. That the approach was fine. I am going to repeat the approach as well at the end. Now I am specifically focusing on the feedback. Then I am going to tell the approach again for the other people as well.
Okay.
So let's talk about the feedback first. So the few things that you could have asked here. You asked to me the symptoms of the problem with the urination, right? And then you started from the dribbling and if there is any hesitancy, poor stream, these symptoms. But there are some other symptoms as well. Do you think there are symptoms which are the mild symptoms, which are showing mild obstruction, outflow obstruction? The other symptoms like, can you name them?
Mild. So I thought that would be like weak stream and hesitancy.
Yeah. These are the symptoms. But before that, some other symptoms like urgency, frequency, nocturia, these symptoms.
Okay.
Which are showing the mild prostate problems or UTI, like mild urinary tract problem, LUTS symptoms, we call them.
Yeah, you're right.
And you asked all the symptoms which are moderate to severe ones. And you did not ask me the mild ones, right?
Yep. Right. You're right.
So that's the point I'm trying to make, that ask few of them, like one question from mild one, and then go on and talk about the medium LUTS symptoms, and then the severe ones.
Okay.
Would be
all right.
great in this way.
Okay.
Because you did not ask me the mild one, so maybe he's having mild problems with the outflow.
Yeah.
So another thing, apart from that, your data gathering was very good. And one thing, when I said I lost my friend was diagnosed with the cancer and I got shattered. Do you think you have to say something here? Because that was my very close friend.
Yes, definitely. Acknowledge. Yeah. You're right.
So you missed that point.
Yeah.
And again, the smoking point, because this patient is already concerned about smoking. So you can advise him about smoking as well. At least try to cut it down.
Right. So in case like in cases like these, when I'm running out of time, would you suggest that I address the smoking like right there and then?
Yeah, you can say this is a point that I will be talking to you about in a while. So I will get back to this point in a while because it's very important.
I see.
So
just at
like
least flag it. Okay.
Yeah.
Okay, got it.
So that in the later part, you will not be having enough time for that.
Okay.
And also because this is a kind of counseling session, don't you think? This patient is here because of counseling. So it would be great if you are cutting down your history part. So you took your history for about 5.5, more than like 5 minutes and 45 seconds. You were taking your history.
Okay.
Okay.
Right.
So it would be great if you are cutting down your history to 4.5 and the 1 minute, how you are going to utilize that 1 extra minute. I will tell you another thing about that right now, but it would be good if you are cutting down your history a little bit. 4.5 minutes enough, because this was supposed to be a kind of counseling. This patient has a demand, and when we are talking to someone who is having a demand like this, they are asking you anything. It can be prostate cancer test, it can be any other thing. So the approach will stay the same. How you are going to negotiate with that guy is once you got to know that he wants to do prostate cancer test. After that, you can ask his understanding about that. Okay, so I understand that you are here for the prostate cancer test. May I know what is your understanding about it? Why we are doing this test? Okay, so say he's saying that it is a test for cancer, then you can try to tell him that, yeah, you are right, this is a test for cancer, but there are many other reasons in which this PSA will be high.
Yeah.
Like, you know, the BPH. If you are talking to him about the examination results and all, then you can talk about like the BPH you are having. It's not cancer. It's only the harmless enlargement of prostate. But not, right, because of this, your test PSA will be high. Similarly, after some kind of infections, it will be high. If there is any instrumentation or trauma to the prostate, then it will be high. Many other reasons, this test will be high. So at your age, if you are having the symptom and you are very concerned about it, then we can go ahead with the test. But it is my duty to tell you the positive and negative sides. So if it is a good test to screen the prostate cancer, we can get to know about the cancer. But at the same time, it can give rise to some unnecessary investigations as well. And some of them can be invasive.
Yeah.
Okay. So this is a blood test, and after that, if it is positive, we need to take the sample from the prostate. So that's why before prescribing the test, we need to make sure you are having the symptoms, and I need to discuss with my senior as well.
Yeah.
So it's my job to tell you the both sides, positive and negative sides. So in this way, you will try to negotiate with that patient. And I think it will be great if you are having 1 more minute so that you can talk about all these things to that guy.
Yeah. Would you advise that I just skip on taking the history, or at least, I don't know how to do this, but should I just like not ask about the whole anxiety situation and the treatment and all of that?
You cannot skip the history because you need to make sure this patient is doing fine. So one way is that when you opened the station, you talked to me that which test you want. Then I told you prostate test, and then I gave you the story of my friend. And after that, you can ask me my understanding about why we are going to do the test. And then I will tell you that I think it is because you this test, if this test is positive, then I will get to know that I am having a cancer. And then at that time, you can tell me, yeah, you are right, it can be positive in cancer, but there are many other things as well in which this test is going to be positive. Can we have a little chat with you to know about your health condition in detail? And then I will be in a better position to tell you. So I have touched this negotiation part in the beginning.
Okay.
And the management, then it will be easier for me to tackle. And then I will easily tell him that after having chat with you and after the examination, your prostate is a little bit enlarged, but that is quite reassuring that you are not having any cancer symptoms. You are not having any symptom which is showing problem with the prostate right now. But in the future, if you are having this symptom, you can come back to us and we will be proceeding from there onwards.
Okay. All right.
Okay, so if you are trying to touch this negotiation part in the beginning, then automatically your history will not be that much long. You are focusing specifically on the factors which are going to be the risk factor for prostate cancer. Focus only on that.
Yep. Okay.
In the history part.
All right.
Is it clear for you? If anything in your mind, then you can ask me.
No, it's clear. Thank you, doctor.
And otherwise, your approach was really good. Just a little bit time management is concerning for me. Otherwise, you reassured me in a very good way. You tackled the point when I asked you, can you do it right now? You remembered that right now because you did DRE, so you cannot proceed with the test right now. There are some other contraindications as well. So you need to tell, you can, if you have time, you can tell these things as well to that patient. Before doing the test, please be careful with these things so that we are getting the accurate results.
That's right. Okay.
Okay. So just to summarize this, any question, Dr. Farah?
No questions. Thank you.
Okay. Good luck for your exam.
Thank you so much.
And for other people, I'm going to, summarize all these things. And Dr. Amina, I think that session would have been clear for you. And now you will remember this, that don't move forward if you don't know the cause of the cancer or what is in my mind. Don't assume anything. Try to get to the bottom of the situation, that what cancer I am talking about, and then proceed. Are you there? Dr. Amina, are you there? Okay, I think she is not here. So yeah, let's talk.
No, doctor, I'm here. Yes.
All right. Okay. So now you will remember this station, right? You will not move forward until you get to know what specific thing is in the patient's mind. Don't assume anything. Doctor. Ask him.
Okay, doctor.
Okay. And I'm sure you will be doing much better in next time.
Thank you.
Otherwise, your approach was fine. The only problem was that you did not ask me which cancer and which test, and this changed your station.
Yeah.
Okay, so let's summarize all these things. So when someone is coming with the demand, in the same way someone is rejecting any treatment. So your first thing should be why you are having this demand or why you are rejecting this treatment, right? So after you know the reason, you can, if like say I'm saying I want to go for the PSA test, or I'm saying that I want to go for another kind of test. Say I want to go for endoscopy, I want to go for a specific biopsy of anything. So ask me my understanding, what I think about it. So after knowing my understanding, it will be easier for you to make my mind. So you can tell that this is the reason. Yeah, you are right. If you are concerned about cancer, it can be positive in cancer, but there are many other reasons for it as well. So would that be okay if we are going and we are talking to you about your general health, and then I will be getting back to this point in a while. So yeah, so then go for the history taking, specifically look for the risk factors of that particular cancer or if it is any particular disease condition, specifically look for the risk factor, focused question, and then mention the examination. And depending on your data gathering, depending on your management, you will be satisfying that patient. For example, in this case, if this patient was having symptoms of LUTS, lower urinary tract obstruction, I was having symptoms of frequency, nocturia, maybe a poor stream. In that situation, first of all, in the management, you will tell me that because I am symptomatic and I am having BPH on examination, so you can discuss with your senior, or you can involve a specialist here so that you can start the treatment for BPH. Secondly, since this patient is having these symptoms, this patient is having old age, so you can tell him that you can discuss with your senior and can arrange the test for you. So the approach will be different according to the history. Is it clear for everybody? And third thing is, this station can come as a combined station as well. So if it is a combined station, then the approach for combined station will be 2 minutes for data gathering, only 2 minutes. So focus on the present, like patient is saying, I want the cancer test. So get to the bottom of that, which cancer test you want, and then ask a few symptoms about prostate, and then go for the examination. So here you have to perform DRE. There will be mannequin inside the cubicle, you need to do DRE. And after DRE, you will be getting prostate enlarged in that. And from the history, specifically look for the prostate symptoms, floss symptoms, fever, lumps and bumps, weight loss, appetite loss, back pain, and then ask a little bit about the medical conditions this patient is having. You can skip smoking, alcohol, these kind of things. First, do the examination part, and then before 6 minutes, if you are having time, you can go ahead and you can talk about the rest of the history. Like if you want to talk about lifestyle, smoking, you want to talk about smoking, you want to talk about family history of prostate cancer. And after 6 minute bell, you will be talking about the management. So we have to start a new meeting, and then I will be giving you some tips about this station, combined station.